With the change in the seasons and with the winters coming, there is a sudden spurt of flu. And it is very important for all of us to know a little bit more about what can be done to deal with the flu. And instead of me as a neurosurgeon talking about it, I thought it's much better to have somebody with complete expertise in this field to enlighten us about what would be the best way to deal with the flu. So here I have Dr. Chandrashekhar Tulsigiri.
Thank you, Sunil, for the kind introduction. The flu, it's also called a common cold, and it generally repeats every year, especially during the winter season. There are many reasons for that. One of them is because it is a viral infection. The immunity acquired in a previous infection is very short lasted, and every time there might be a new strain of this influenza virus is coming. That's why generally it comes back every year.
So since we know it occurs at around this period, what would be the precautionary measures that we can take to prevent this from occurring to us and our family members?
Yes. Flu or influenza infection or a common cold, it is a contagious one and generally spreads by droplet infections, and it can be prevented, and most of us are expert in these prevention of these droplet infections by now because of the COVID in the recent past, and not so aggressively like COVID, but at least some of them, at least like a hand hygiene and maintaining a distance, whoever is infected, at least in such cases in the family members, if they maintain distance, these common cold or flu can be prevented.
Okay. And the good thing about flu is usually it is self-limiting and I think doesn't harm us much, except for in very specific cases. So, Dr. Chandrasekhar, who are those people who would be more prone to more severe forms of flu?
Yes, some of us are prone for the severe forms of the flu. They are called a high risk individuals. Generally, the elderly age group of more than 55 to 60-year age group, diabetic, obesity, or any other comorbidities like lung disease, underlying lung disease like asthma, COPD, organ transplant, and any chronic illnesses. For that, any medications, something like immune suppressants or immune modulators are on, then these groups are called as high risk individuals. So they need special preventive measures to prevent the infection, something like commonly the hand hygiene and droplet infection prevention, and along with that immunization to prevent the flu infection in these patients or the high risk individuals is required and recommended.
So it is interesting that even for adults now there is a role of immunization, especially in these high risk individuals. When it comes to even the common flu or the common cold, to prevent
Yes.
the more severe forms of the disease or getting the disease from more complicated.
Yes, we have very aggressive immunization programs for the pediatric age groups, but across the globe, the well-known fact is that the adult immunization is also equally important, at least for the high-risk individuals and the elderly individuals. So these, other than the COVID vaccination, the flu vaccination is also important in these high-risk individuals.
So where exactly would be the role of an intensivist or a physician like you in the case of flu. So I don't think most of the patients would be reaching it, because most of the patients would themselves be self-medicating, taking a paracetamol tablet when the fever is there, considering it to be the common flu. So where do you really come to play?
Flu is generally a self-limiting illness. That's why it is called as a common flu. And but the people with the high risk, and the people already we have discussed the high risk group. These high risk individuals, some of them, they may get a flu infection and they progress to become a severe illness. If the flu signs symptoms are severe and it's not self-limiting, it's then we should reach out to the doctor. And especially when the persistent fever is there, when the patient is having breathing difficulties, definitely we should reach out to the doctor. The doctor will decide whether it is a plain simple flu infection, or whether it is a secondary bacterial infection or a complicated flu infection.
So largely, as far as flu goes, preventive actions would be the best form of treatment over here. So largely your hygiene should be on the better side. Apart from avoiding crowded places, when you know the flu is lurking around, it's better to avoid crowded places. But yeah, very difficult in the kind of society that we live in. In a metro, it's extremely difficult. But yes, again, maintaining your immunity, I think, would also play a big role in this.
Yes, avoiding the crowded places and the person-to-person contact, at least for the high-risk individuals, whoever is at the higher risk, it is very important. Other than that, flu is a very common infection and it's self-limiting problem. Yes, for the same group of people, that is the high-risk individual groups, the immunization and immune modulation, by either by immunization or by maintaining the good health and nutrition and exercise, these things are important to.
So all in all, I can very safely say that most of the patients of flu would not have to really reach out to an intensive care specialist like you, but it is very important that they are aware of the repercussions it could have in patients who are at high risk. And if they are in touch with patients, or they have relatives who are belong to this high risk group, then we're supposed to be careful even with something as simple as a common cold. I think that's a very good note to end this small discussion on. Hope to see you back here again, Chandrashekhar, on different and more interesting topics.
Thank you, Dr. Kutty, and thank you.